Howdy, everybody. We have a great show today. We're going to talk about a couple different things. We will talk about, does fasting in any way affect your bowel habits? We will talk about how long can a Crohn's flare last. We'll talk about how to eliminate sugar cravings and how to eliminate that feeling of getting hungry all the time. We'll talk about, does weight loss help with bloating as well? And we will talk about the new medications that are out there for weight loss. Guys, I'm excited about today's video, and let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns. And I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. Hey guys, Dr. Islam here. I hope you guys are having a great Tuesday. We have a great show tonight. We're going to talk about a whole bunch of different things. And if this is the first time for you guys to watch tonight, I am your poop guru. Every Tuesday, I go on the social media platform to talk about any questions you guys may have. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter. I'll put a link down below where you can get great tips and tricks. So let me know if you're watching this live or on the replay and where you guys are watching this from as well. Hope you guys are doing great. Hope you guys are having a great Tuesday. So we have a couple of great questions we're going to talk about today. One of the first things I want to talk about is a new weight loss medication I just got approved by the FDA called Wegovy. Now you may, Wegovy, I apologize. So you may have seen this on the news and on social media as well. It's the first weight loss medication that's been approved by the FDA since 2014. So 7 years since we approved, since the government or the FDA approved a weight loss medication. And this seems to have some of the better benefits in terms of weight loss. This works similar to other diabetes medications. It's a once weekly injection that you give yourself. And the average weight loss is greater than 10% of your body mass, which is, or body weight, which is a fantastic number. Most of the other numbers when it comes to weight loss are not that high. Some of the more common side effects that have been seen with this particular medication include nausea, vomiting, diarrhea, which have been self-limiting. But for those patients who qualify, this looks like it's a very, at least the initial studies, looks like this is a fantastic medication to help control weight loss issues and hopefully manage that and get that taken care of as well. Now, we don't know exactly what the insurance companies are going to pay for this. We don't know exactly if it's going to be covered under plans. We don't know exactly what that is going to be. We'll know in the next couple of weeks or a couple of months when it comes to that. But I am very excited to have this as a possible option for our patients who are trying to lose that weight but not been able to do it. And I'm very excited about this being a possible option to hopefully use in addition to exercise and diet to hopefully allow our patients to get better weight loss than what they had before. So I'm excited about this new medication. Stay tuned with future videos on what options we can do when it comes to weight loss as well. So that's the first thing I want to talk about. Question number one, I got, hey, Dr. Islam, does fasting in any way affect your bowel habits? So you guys know, if you've been watching me for a while, I am a big fan when it comes to fasting. I've been doing this for a long time.
I really recommend intermittent fasting to a lot of my patients, especially if they have bowel issues. So for a lot of my patients, fasting can be a benefit when it comes to their bowel habits. It can make things like diarrhea and constipation a lot easier to manage because mainly you're not having as much food coming in. But what we're also seeing is that there is a significant change in your gut microbiome as well when it comes to fasting. We're seeing this in more and more studies, how the long-term effects when it comes to fasting can really make things a lot better for your gut health. In addition, we're also seeing that introducing fasting can actually help prolong your life. Yes, we're seeing more and more information where it comes to that, where fasting will actually improve your life as well. Now, for some people, if you're not having the right types of food coming in, it can negatively affect your bowel habits. So, for example, if you're not having a lot of fiber or not having a lot of water, you may be more constipated than what you normally are. Or let's say you're fasting, you're still eating really not good food. Well, you're going to have more of that food that's in you with less amount of room inside your stomach, and that's not going to be good for your gut health as well. So fasting in and of itself is not an end-all be-all. If you couple this with other options to improve your gut health, this will make things a lot better for your GI tract and hopefully improve some of your gut conditions as well. B, it's good seeing you. Pam, it's good seeing you. Paul, it's good seeing you. Joyce, it's good seeing you guys. Thank you guys for watching on the live channel. So Paul has a good question. Does gastritis cause constipation? And the answer to this is no, it does not. So gastritis is an upper GI problem which typically affects your stomach, which you can get inflammation for a number of different reasons, whether it's medications, whether it's ulcers, whether it's alcohol, whether it's other things like that. These are very common causes to cause gastritis. But gastritis in and of itself will not cause constipation, will not cause your bowels to not work. That usually is a separate issue of what's going on. So there's no correlation typically between what's going on in the upper GI tract with respect to gastritis and what could be going on down below. Great question that you asked. All right, question number 2. Hey, Dr. Islam, I have been having a Crohn's flare. How long does that usually last? So for those guys who don't know what Crohn's disease is an inflammatory bowel disease in which your body attacks itself to cause various symptoms: nausea, vomiting, diarrhea, anemia, fevers, abdominal pain, diarrhea, things like that. Now, whenever you have a flare of your disease, that means that you have active inflammation going on inside your gut. It's like your gut is on fire, and having that flare is like pouring gasoline on that fire. Things end up acting up. You have worsening diarrhea, worsening blood, worsening pain, more nausea and vomiting, more weight loss. And sometimes that flare can last for quite some time unless we can find something to douse that pain. Now, whenever somebody has a flare, we want to see if we can find out what is going on. Is it an actual flare from your Crohn's disease, or do you have something else going on top of that? Whether it's an infection like C. diff, whether it's another condition like small intestinal bacterial overgrowth or Sibo, whether it's irritable bowel syndrome, or maybe it's another condition that's going on. We want to help clarify what is going on, because the treatment for a flare is very different from a treatment for those other conditions. Now, the flare can last from anywhere from days to weeks. Now, if it lasts for more than a couple of days without any treatment, which you typically do need treatment for, we may have to undergo a little bit more of an aggressive therapy to get that taken care of for you, whether it's hospitalization or sometimes even surgery as well. So there's no real kind of time frame when it comes to a flare, but if you feel like you're having an active flare, you need to make sure you see a healthcare provider to get that taken care of for you as well. Joyce, is good seeing you. Amy, is good seeing you. Carol, thank you for watching at home in Lubbock. All right, question from Luis Orodensco. I apologize. Can fasting cause gastritis, or does fasting help gastritis? Thanks, Lois from Denver. Oh, Lois, I apologize. I totally put that into one word. So fasting does not cause gastritis, but fasting can help with gastritis. Yes, it can. In fact, this is one of the more kind of natural, effective ways that you can use to help control what's going on inside your upper GI tract. And I use this commonly in my patients to help out with upper GI issues. And so if you're interested in possibly doing this, make sure you speak to your healthcare provider, make sure it's safe for you, and you'd be surprised, you actually may end up feeling better from your gastritis because of doing something like intermittent fasting or fasting. And this is one of the treatments that I recommend for my patients. Great question. All right, question number 3. Hey, Dr. Islam, how can I eliminate those sugar cravings but without feeling hungry all the time? Sugar, the bane of our existence. Yes, there is so much sugar in everything, and that sugar over time can get you so used to that input that you just feel like you have to have it over and over and over again. And it's not just sugar, it's other things like sugar, like for example, fructose or sucrose, which are artificial sugars that give you that sugar taste without necessarily having those calories that can cause a lot of gut issues. So here are my thoughts. Number 1, I'll be honest with you, it is hard to give up sugar cold turkey. It is hard because not only is your body used to it, but you yourself are used to that craving as well. So maybe you may want to consider maybe halving the amount of sugar that you have. So instead of having that, maybe 20 or 30 grams of sugar, half that. So for example, if you're having a whole Coke, 2 or 3 Cokes per day, maybe go down to maybe 1 Coke per day or 2 Coke per day. Go down on a kind of a slow time frame so you don't give your body such a shock to the system. Number 2, try to find something else to substitute on top of that. Now, I know it's hard to find something else to substitute when it comes to sugar because sugar tastes so good, but maybe try another thing. Maybe there are very healthy popsicles, for example, that are out there which can be used instead. Maybe you want to give yourself a treat. Maybe you want to have a small little cookie, which may not have as much sugar, but at least helps to reward that reward center that you're having as well. And honestly, sometimes you may just want to drink a lot more water because water in and of itself will keep you fuller longer and will help decrease those cravings as well and to make you feel better. It is a hard thing to try to struggle against those cravings because keep in mind, when you have that much sugar, your brain is rewired to want that reward, to get that. It's almost as if you're having a drug. And by slowly introducing things that can act as a reward for you will help out. By maybe not going cold turkey will help out. Sometimes adding water to your diet will help out with those cravings as well. These are some of the things that I recommend to help minimize those sugar cravings. I had this problem a long time ago. I used to be such an addict when it comes to sugar, but I came to realize, hey, this sucks. And I don't feel good when I have that much sugar. So I slowly started to wean myself off. I did the things that I recommend in this video, and I'll tell you, it worked for me, and it's worked for other patients of mine as well. All right, Pamela, good question. Does fasting help out with reflux? Yes, it does. So reflux very commonly is a lifestyle disease. The more that you enjoy your life, the more you're going to have the disease. So if you have foods all the time, or if you have foods that are not good for you, that is going to make your reflux symptoms worse. And so by eliminating one source of food, you're going to decrease the risk factor for having acid reflux. But not only that, you're actually going to shrink your stomach and take in less calories. And if you're overweight, this is going to be one effective natural way for you to lose weight. And by doing that, that is probably the best thing that you can do when it comes to acid reflux. Weight loss by far, more than anything else you can do, has the best way and the best risk factor for pretty much getting rid of acid reflux. The data is very clear on this. And by doing fasting, you are eliminating one meal. And by eliminating one meal, you're actually going to improve your acid reflux. So yes, Pamela, it will help out. All right, perfect. Last question I got. Hey, Dr. Islam, does weight loss help out with bloating and gas? So how many guys down below, let me know, suffer from bloating and gas? It is such a common problem that I see all the time in my clinic. And one of the reasons you could be having a lot of bloating and gas could be that weight. Absolutely. So if you are overweight, you have bloating and gas, that weight gain can cause so many different gut issues to occur because of the fat that's there. But not only that, the reason why you're having that weight gain could be a reason why you're having the bloating and the gas. It could be the foods that you're eating. Maybe it's the way you're digesting. Maybe it's the effect of that fat inside your gut that can make bloating and gas a lot more difficult and a lot more troublesome for a lot of our patients. So yes, losing weight can do a tremendous amount of benefit to your gut health and to your GI tract as well, including improving bloating and gas. Absolutely can do that. All right. So Adrian Smart, good question. What can I eat every day to make me poop? All right, great question. So basically, I want to tell you exactly what I recommend to have an epic dump. Yes, an epic dump. Here's what you need to do. Number one, you really need to have a diet that is high in fruits and vegetables. You really do. And in fact, I recommend a plant-based diet or a Mediterranean type diet. This is going to help you have more effective bowel habits. Number one. Number two, you really need to incorporate some of the foods that can really help you have a better bowel movements. The foods that we know kiwi has been shown in clinical trials to help you have a bowel movement. We know that prunes have been shown in clinical trials to help you have a bowel movement. We also know that foods like dates have been shown to help improve your bowel habits. This will work. Tip number 3, consider adding magnesium to your diet. Now, I always recommend to add magnesium under the supervision of a doctor so we can check your magnesium levels. But these are things that you can do. Sometimes over-the-counter magnesium pills will work. You have to kind of titrate it based on your body. But like I always say, do this under the supervision of a doctor so that we can check your magnesium levels to make sure things are doing well. But these are some of the simple things that we recommend as a GI doctor to help you poop and to have an epic bowel movement. Great question. So Nakia, good question. Are prebiotics good for people with food allergens? Yes, absolutely. So prebiotics are natural foods to help enhance what's going on inside your gut naturally. And I am a big proponent of prebiotics. They work fantastic. And fiber or plants are the best prebiotics that you can do. And so yes, prebiotics are great for people for just in general health, but also if you're having kind of food intolerances or food allergens, this will help to replenish your gut microbiome. And you may come to realize that those foods that you were allergic to, right, issues with in the past, you're able to eat them again because your gut microbiome is replenished. Things that were kind of jacked up inside your gut have gotten better again, and it can make you feel better as well. So yes, prebiotic foods are very helpful for individuals who have gut allergies, gut issues, but also for those people who may have food allergens as well. Great question. I love that. All right, perfect. All right, Carol, good question. How often can I have a colonoscopy if a precancerous polyp were removed? So I will tell you this. So if you've had a precancerous polyp removed, this means that your body is most likely going to develop more and more of these polyps. And depending on the type of polyps that were removed, depending on the size of the polyps, also depending on your family history, that may be 5 or 3 or 1 year. So Carol, I would tell you, if you're waiting greater than 10 years, you're kind of already a little bit late. You need to get this taken care of sooner rather than later. If you've had precancerous polyps, there is something inside your GI tract or genetics that's making it more likely for you to develop these polyps, which means that we need to do investigations sooner, quicker to see exactly what's going on to make sure everything is taken care of. So great question, but yes, you need to get this done sooner rather than later. All right. Oh, perfect. All right, this is a great question. So Andrew, great question. You were diagnosed with Sibo with both methane and hydrogen levels. You were put on rifaximin and neomycin. Any tips for rebuilding the biome in a healthy way since I have somewhat of a clean slate? Great question. So small intestinal bacterial overgrowth, or Sibo, is a predominance of bad bacteria inside the GI tract for any number of different reasons. Some people can maybe be predisposed to that because of certain medical conditions like scleroderma, diabetes, or liver disease. Some people can get this from taking different medications as well. And whenever you have a predominance of bad bacteria, this can produce symptoms like bloating, distension, diarrhea, nausea, upset stomach, IBS type symptoms. In fact, there is good evidence that a certain percentage of patients who have IBS also have small intestinal bacterial overgrowth. So one of the treatments that we give is that we give antibiotics to help clear the gut microbiome to make it normal again, to replenish the good guys. So now that you're at a clean slate, what do you need to do? So the best thing by far to improve your gut microbiome is to have a diet that has a wide variety of plants and vegetables. By far, this is the most effective thing you can do to help grow that bacteria, make it normal again, improve your gut microbiome. And if you've had a clean slate from getting your gut bacteria altered, this is the best way to replenish that garden, make it better again, get you feeling better, and to do that. So more than anything else that you can do, having a gut microbiome that has a wide variety of plants and vegetables will be the thing that you can do to hopefully improve what is going on and to get you feeling better as well, and to make sure that you don't have this condition that can come back again. So that's exactly what I'm going to do. Good question, guys. Good. So Katie, good question. Can you have constipation but still have Sibo? Yes, you can. And so we are seeing a predominance of what's called methane predominant small intestinal bacterial overgrowth. And we are seeing that some of these patients actually present with constipation. So what we think is going on is that methane actually helps us slow down the gut microbiome and slow down the motility of your GI tract. And so we would have to change what's going on inside your gut. And for some of these patients, we'll give them actually pro-motility agents to help sweep what's going on, get rid of the predominance of methane, and to actually have you to have more effective bowel habits. So yes, there is evidence that there are some patients who are constipated, and the constipation can be due to a certain predominance of bad bacteria that produces more methane, and that methane, excuse me, can actually help slow down your gut GI tract and your gut motility. So yes, that is true. Good, perfect. All right, perfect. All right, guys. All right. Perfect. All right, guys. Well, I want to thank you guys for for watching on today's video. Hope you guys have a great day. Don't forget, if you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter. If you want your question sent to me, go ahead and send me a message on DM. Subscribe to a weekly newsletter. I love to hear more questions you guys may have. I can't speak. More questions you guys may have. Hope you guys have a great and happy day. And I want to thank you guys for watching. Thanks, guys. Take care. Bye, everybody.